Bronchitis is an inflammation of the bronchial tubes, which are the airways that carry air to your lungs. Imagine the structure of your respiratory system like an upside-down tree. The trachea, or windpipe, is the trunk, and it branches out into two large bronchi, one for each lung. These bronchi then branch into smaller and smaller tubes called bronchioles. When these tubes become inflamed, they swell and produce mucus, which narrows the airways and makes it difficult to breathe. This is bronchitis in a nutshell. There are two primary types of bronchitis: acute and chronic. Acute bronchitis is a short-term inflammation of the bronchi that typically follows a viral infection, such as the common cold or the flu. It's the kind of bronchitis that makes you miserable for a couple of weeks, but then goes away as your body fights off the infection. On the other hand, chronic bronchitis is a long-term condition that is characterized by a persistent, productive cough that lasts for at least 3 months in a year and recurs for at least 2 consecutive years. This type of bronchitis is a serious condition and is part of a group of lung diseases known as chronic obstructive pulmonary disease, or COPD. So what causes bronchitis? The primary cause of acute bronchitis is viral infections. The same viruses that cause colds and the flu can also lead to bronchitis. When these viruses infect your respiratory system, they can spread to the bronchi, causing them to become inflamed and produce excess mucus. Bacteria can also cause acute bronchitis, but this is less common. Picture your airways like a garden hose. When they become swollen and filled with mucus, it's like trying to get water through a clogged hose. Breathing becomes difficult, and you start coughing as your body tries to clear out the blockage. Chronic bronchitis has different causes. The most common cause is smoking. The chemicals in cigarettes irritate the lining of the bronchial tubes, leading to chronic inflammation and increased mucus production. Over time, this repeated irritation causes the airways to thicken and narrow, making it difficult to breathe. Other causes of chronic bronchitis include long-term exposure to air pollution, dust, and toxic gases. These irritants can come from various sources, such as industrial emissions, vehicle exhaust, or even long-term exposure to dust in certain occupations. Sometimes, chronic bronchitis can develop due to a history of frequent lung infections, which cause repeated damage to the bronchial tubes. So, how do you know if you have bronchitis? The symptoms can vary, but there are some telltale signs. The most common symptom is a persistent cough that brings up mucus. This mucus can be clear, yellow, white, or even greenish. If you have acute bronchitis, the cough usually starts suddenly and lasts for a couple of weeks. You might also feel super tired, have a fever, and feel like you have a cold with a stuffy or runny nose. Your chest might feel tight or sore from all the coughing. It's like your body's way of telling you to slow down and take it easy. Chronic bronchitis symptoms are a bit different. The cough lasts for at least 3 months and comes back for at least 2 consecutive years. You'll also have shortness of breath, especially during physical activities, and wheezing, which is a high-pitched whistling sound when you breathe. Over time, the mucus becomes thicker and more troublesome. Imagine trying to catch your breath while carrying a heavy backpack. That's how it feels for someone with chronic bronchitis. They might also experience frequent respiratory infections, like colds or flu, because their airways are constantly irritated and more vulnerable to germs. Diagnosis of bronchitis. To diagnose bronchitis, doctors start with a thorough history and physical exam. They'll listen to your lungs with a stethoscope for any unusual sounds like wheezing or crackling. They'll also ask about your symptoms, how long you've had them, and any history of smoking or exposure to irritants. If they suspect bronchitis, they might order a few tests to confirm the diagnosis and rule out other conditions. One common test is a chest X-ray. This helps doctors see if there's any infection or other issues in your lungs. Sometimes they'll do a sputum test, where they take a sample of the mucus you're coughing up to check for bacteria or other pathogens. This can help determine if antibiotics might be needed. Another important test is spirometry, which measures how well your lungs are working. You'll blow into a device that measures the amount of air you can exhale and how quickly you can do it. This helps assess if there's any obstruction in your airways, which is common in chronic bronchitis. Before we continue, if you have been enjoying the video so far, Hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Treatment of bronchitis. The approach to treating bronchitis depends on whether it's acute or chronic. For acute bronchitis, most of the time, the condition is self-limiting, meaning it will get better on its own. Since viruses cause the majority of cases, antibiotics aren't usually necessary or helpful. Instead, the focus is on relieving symptoms and supporting your immune system. You can start by getting plenty of rest and staying hydrated. Drinking fluids helps thin the mucus in your lungs, making it easier to cough up. Warm liquids like tea, broth, or honey and lemon in hot water can be particularly soothing. Over-the-counter medications can help too. For instance, a pain reliever like acetaminophen or ibuprofen can reduce fever and alleviate aches and pains. Cough medicines can also be used with caution. Some of them are designed to suppress a dry cough, while others help loosen mucus. Just make sure to read the labels and follow the instructions. Using a humidifier at home can also be beneficial. Moist air helps soothe irritated airways and can ease coughing. Breathing in steam from a hot shower or a bowl of hot water with a towel over your head can have a similar effect. If your symptoms are severe or not improving after a few weeks, it's a good idea to check back with your doctor. They might want to re-evaluate to ensure there's no secondary infection or other complications. Chronic bronchitis, on the other hand, requires a more comprehensive approach since it's a long-term condition. The first step is to quit smoking if you haven't already. This can be challenging, but it's the most important thing you can do to improve your lung health. There are many resources available, including nicotine replacement therapies, medications, and support groups. Medications play a key role in managing chronic bronchitis. Bronchodilators are commonly prescribed, as they help open up the airways and make breathing easier. These can be short-acting for quick relief or long-acting for ongoing management. Inhaled steroids might also be used to reduce inflammation in the airways. If you have frequent flare-ups or infections, your doctor might prescribe antibiotics or antiviral medications as needed. Pulmonary rehabilitation is another helpful tool. This is a structured program that includes exercise training, education, and support to help you manage your condition. It's designed to improve your overall fitness and quality of life. Imagine it as a personal training program for your lungs, helping you get stronger and breathe better. Lifestyle changes are crucial too. Eating a healthy diet, staying active, and avoiding respiratory irritants can make a big difference. Even simple activities like walking or light aerobic exercises can help keep your lungs in better shape. Just be sure to pace yourself and listen to your body. In some severe cases, where chronic bronchitis leads to significant lung damage, oxygen therapy might be necessary. This involves using a device to provide extra oxygen, helping you breathe more easily. It can be used at home and during activities to improve your oxygen levels and overall comfort. At the end, living with chronic bronchitis can be challenging, but with the right approach, many people manage their symptoms and lead fulfilling lives. Staying on top of your treatment plan, working closely with your healthcare team, and making healthy lifestyle choices are key steps in maintaining your lung health. Now, we want to hear from you. Do you or someone you know have bronchitis? Which of these symptoms did you have? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.